Greetings to everyone who is watching my video. Today I am going to talk about strategies to pass Nclex exam. Nclex exam is a license exam for RNs and LVNs. Most important than anything is safety. Safety is reflected in mostly all questions in Nclex. Let's do this question. You can pause the video now and read this question. The answer is 3. Flush the eyes with water continuously for 20 minutes. Most safe intervention is to flush eyes with this water. Always remember you work in an ideal situation in this exam, not the actual situation. You might have seen nurses are so busy, staff shortage, but that's what is not in this exam. You are in an ideal hospital, you have all the resources, and most importantly, you have doctor's orders for everything they ask you in the exam. If your question requires you to sit with your patient, go ahead and sit with your patient. You have all the time in the world to sit with your patient. Lots of priority questions are asked in this exam. Priority questions usually starts with best, most important, first, initial response by the nurse. Okay, so let's talk about some equipments. Whenever your patient is attached to any equipment, first take care of the patient and then equipment. Most of our patients are attached to electronic devices, for example, ECG, ventilator, IV pump, and many more. Most of their machines or devices have alarms for the safety of patient. The rule of thumb is to check on your patient first when an alarm goes off. For example, if the ventilator alarms, check your patient first. Maybe your patient got extubated and struggling to breathe. If IV pump alarms, check the patient and check the IV site. IV site may be blocked. If the EKG monitor alarms, check your patient may be having a heart attack and need resuscitation. Okay, let's do this question. An alarm on client's ventilator keeps sounding. What is the nurse's first action? The first action is to check patient's airway and ventilator connections. If your patient is on traction and complaining of severe pain in the leg, instead of checking traction, pulleys, and weight, you should check your patient first and assess the extremity for signs of compartment syndrome. Most of the time, Nclex does not want you to call the doctor because the exam wants to judge your critical thinking and what's your intervention. But at the same time, you should also know when to call the provider. For example, in emergency surgeries, strangulation of hernia, compartment syndrome, just to make sure, do your assessment to make sure that it's an emergency. And once you figure out that it's an emergency situation, then go ahead and contact the physician. In most of the surgeries, the deep breathing and coughing exercises are done to prevent atelectasis and as well as pneumonia. In certain surgeries, only deep breathing is advised, no coughing. For example, in a brain surgery, if patient coughs, it can cause increased intracranial pressure. Hernia repair surgery, patient should avoid vigorous coughing if hernia repair is done with an open method. Eye surgery, patient should avoid coughing after eye surgery because it can increase the eye pressure. Let's do this question. You can pause the video and read the question. As you notice that this is a surgery for the reduction of hernia. So we already know that we are not going to advise this patient cuffing exercise, right? So the choice 1 is not correct. So here the right answer is using a scrotal support. Nclex also asks about the complications related to surgery. If surgery is done in the upper part of the body, the most common complications are related to lungs. For example, atelectasis, pneumonia, etc. Usually we need to do some actions or some interventions to prevent those complications. If the surgery is done at the lower part of the body, then the complications are related to clotting. In this situation, the most of the interventions are done to prevent the clotting, which is early mobilization of patient, giving a blood thinner to the patient in post-surgical time. Let's do this question. A woman had an abdominal hysterectomy this morning. Because of the location of her surgery, the nurse knows the client is at increased risk for, and it's a lower part. This surgery is done in the lower part of the body because the uterus is situated inside the pelvic bone. So the complication is thrombophlebitis. So this patient is a risk for thrombophlebitis. So in this situation, we give a blood thinner to the patient after surgery. Priority questions are the one which starts with best, most important. First, initial response by nurse. You always say patient, no matter what. Priority issues can be related to issues. For example, ABC issue. If it is a ABC, then look for the airway. If it is a issues related to nursing process, then always remember you have to do a nursing assessment before you do the intervention. If the priority question is related to a mass loss issue, and we know that we always look into the physiological needs before we do any other need. Then if it is related to survival potential, you make sure your patients survive. If you have a situation where so many people are dying, then you make sure you can save the maximum patients you can. So we are talking about the triage outside the hospital situation. So please keep practicing for your questions, and I hope you enjoyed my video. Please give comments if you like my video, and also please subscribe the video. Thank you so much.